Hello, I'm Donna Walsh, Health Officer for the Florida Department of Health in Seminole County and your Healthy Seminole host. Many in our community face barriers to access health services. Studies show that mobile health clinics are effective in facilitating access to health care, particularly for high-risk or stigmatized populations, such as the homeless and individuals with multiple risk factors for diseases. Today, we will see how healthcare agencies are reaching out to communities in Seminole County with limited access through mobile health services to address disparities in underserved populations and help lower the use of emergency services in the hospital. Joining us is Chichi Iguatu, COPD Pneumonia Care Coordinator from Orlando Health. Welcome, Chichi. Thank you for joining us.
Thank you for having me, Donna.
So, Chichi, I know that the Health Department and Orlando Health work together in a couple of projects, and I just would like to talk to you today about some of those projects. So can you tell me about the Open Airways?
Yes, so the Open Airways, we just started that program with Department of Health this year. And basically, we have a respiratory therapist going out into our elementary schools and teaching kids about asthma. The whole goal of the program is to teach asthma self-management, reduce the amount of hospitalizations and ER visits among kids, and then also to raise awareness with parents, guardians, and school administrators.
Chichi, how many schools have you all visited?
So we've just started, and we're at Hamilton Elementary School right now in Sanford, Florida.
Okay.
We're hoping in the spring more schools will buy into the program and want to be a part of it, which is why the show that you're doing is so important, so we can raise awareness into the community and they know about Open Airways and how important it is to our school-age kids.
That's wonderful. Chichi, along with visiting the schools and educating parents and children and teachers as well, I'm sure, what other services does the Open Airways program provide?
So another thing that Open Airways can do is during the classes, when our respiratory therapists are talking with the students and they're kind of sensing that maybe the kids aren't understanding how to take their medications, or maybe they're having multiple hospital visits, or maybe they don't even have access to a doctor. One of the things that the Department of Health will offer is a community health worker that can make home visits. So they can do follow-up, again, with the parents and kind of sit with the parents and give them additional information, education, and then if necessary, resources. Sometimes we find parents don't have the money to pay for inhalers. They're very expensive or don't have the money for copays. And so the Department of Health offers resources in those situations to help those parents and those kids.
That's great. That's great. I know that we're trying to expand that program as well. You know, the Asthma Coalition and increasing home visitation to a number of parents and families throughout the community. So we really appreciate your partnership in helping us do that. So how is Orlando Health involved in community paramedicine and mobile health services? That's another program I know that we have a partnership with.
Yes, we do. So I am the COPD Pneumonia Care Coordinator for the hospital, and part of that program is I transition patients from the hospital to home. And where community paramedicine comes into play is they do house visits. So a paramedic, when a patient's discharged, a paramedic will come to the patient's home and see how they're doing, but it goes even more in depth than that. So they will check the vitals, help the patient with their medications. I've had my paramedic, he'll go out and he will organize the medication bottles for the patients. He will go back over the meds. You have to realize sometimes patients get a new diagnosis, right? Or they get a whole list of medications that they're not familiar with. It can be overwhelming, it can be daunting. You've been in the hospital for 3 to 5 days and now you're home and you're, saddled with this. So the paramedicine comes in, the community paramedic comes in, and he basically calms the patient down, teach them about their disease, let them know everything is going to be okay, we're here for you. And they make multiple visits, and it's a free service offered through Orlando Health and the Department of Health as well.
That's excellent. Chichi, I know we can't do this alone, right? And so as the community paramedic visits the home and sees the needs, I know that he reaches out to a number of community partners. Can you share with us some of those other partners that help with the program?
Yeah, so one of the main partners that we utilize is the PRN network. That's the Patient Resource Network. It was actually founded by a former police officer, and that's a great resource. They utilize small businesses in the community to help our patients. I've reached out to them. I needed nebulizers for our program, and I reached out to the PRN group, and they were able to contact a church and get me 20 nebulizers. I also had a patient who had a diagnosis, and with that disease diagnosis, she would need equipment at home to take care of her, which caused her electricity bill to go up. She also needed assistance with food. I reached out to the PRN group, and they were able to help her with that as well. So they're amazing. A fantastic organization.
What is one important thing that our audience should know about the Open Airways program? You know, what message would you like to leave for the audience?
So it's important for your audience members to know if they have a child who they think has asthma, a parent, guardian, school officials watching this program, reach out to your principal or school administrators and say, hey, we need to get this program into our schools because our kids need to be educated about asthma. Asthma can go undiagnosed or underdiagnosed. And if that happens, when a child grows up, it can turn into something like COPD and become life-threatening. So it's really important that we educate our school-age kids about asthma, give them the resources they need to treat it. That way they can live a long, productive life.
Thank you so much, Chi-Chi. This is valuable information for our community, and we really appreciate you joining us today. Thank you.
Thank you.
Myrna Chamorro is joining Andrea, founder and director of the Pregnancy Center.
Hi, I'm here with Andrea, who will be speaking about the Pregnancy Center mobile unit today. Hi, Andrea.
Hello there.
We're here with the pregnancy mobile unit that you have. Tell us about how it all started.
Well, our Pregnancy Center has been around for around 21 years, and we have a Sanford location and an Oviedo location. And we realized in Seminole County there's still a lot of underserved areas. So we thought, where are we supposed to be? Are we supposed to add another building? And we felt that the mobile unit allows us the flexibility and the mobility to be in more locations. So that's how the mobile unit came.
Wonderful. So what is the purpose?
The purpose of the mobile unit is to go to, right now we're in Apopka, we're in Castleberry, we're near Seminole State, we're near UCF, but the idea is to bring the Pregnancy Center to her and to go to those areas that aren't, where there is no pregnancy center.
So what are some of the services you provide?
Our primary service is to verify pregnancy. So the girls that come to us, they're in the mind frame of, I think I'm pregnant, and if I am, I don't know what I'm going to do. So the first thing we want to do is verify pregnancy by doing the free pregnancy test and then the ultrasound. And then once we've determined that she's pregnant, then we want to talk about her options.
Okay, so when a person arrives, is it by appointment or they just show up?
It's both. I mean, you can go online and make an appointment online, or you could come in as a walk-in.
Once a person arrives, what can they expect? Who receives them?
Well, they're going to be met with two people, the sonographer and a client advocate. And so the client advocate will start with an intake form, get basic information, and then they'll do a pregnancy test, and then if the test shows positive, then she'll see the sonographer who will do the ultrasound.
So who can benefit from this service?
It's definitely free, it's confidential, and any woman of childbearing age is who we see. The only client that we don't see would be a woman who's already being seen by her doctor. So we're the primary service. We're kind of like the emergency room of a crisis pregnancy. So we want to be a part of the verifying her pregnancy.
Anything else you'd like our viewers to know?
No, just tell people about us. I mean, it's a beautiful mobile unit. From bumper to bumper, it is state of the art. Women, when they walk in, they can't believe how beautiful. I mean, it's like walking into a Learjet. It's so beautifully crafted. It's safe. It's clean, and then, like I said, it's free and it's confidential.
Thank you so much, Andrea, for sharing this information.
Thank you.
Regular health screenings can detect problems before they start. Identifying health issues early improves the chances of successful treatment and cure. Here are 10 recommended screenings for adults. For women, a mammogram and a Pap test done as recommended by your doctor can help prevent or find cancer early. Screening for cholesterol along with living a healthy lifestyle can help keep your cholesterol in a healthy range and lower your risk of heart disease and stroke. All adults who are 50 to 75 years old should be screened for colorectal cancer. 90% of new cases of colorectal cancer occur in people who are 50 or older. About 1 out of 3 adults in the U.S. have high blood pressure. Only about half of the adults with high blood pressure have it under control. High blood pressure is called the silent killer because it often has no warning signs or symptoms. Have your blood pressure checked regularly. Regular dental exams, which involve cleaning and examining your teeth, along with x-rays, can spot early signs of decay and other problems. Vaccines are not just for kids. Adults need to keep their vaccinations up to date because immunity from childhood vaccines can wear off over time. You're also at risk for different diseases as an adult. Vaccination is one of the safest preventive care measures you can take. Remember to get your seasonal flu shot and check with your doctor on other important vaccines. All men are at risk for prostate cancer. A blood test called a PSA test can determine if a prostate problem is likely present. Your doctor can determine if your PSA level is abnormal. Skin cancer is the most common cancer in the United States. Report any unusual moles or other changes in your skin to your doctor. The only way to know for sure whether you have HIV is to get tested. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine health care. Hepatitis is an inflammation of the liver and often caused by a virus. In the U.S., the most common types of viral hepatitis are hepatitis A, B, and C. Learn more about each one and if you should be tested or vaccinated against hepatitis. By getting the right health screenings and early treatment if needed, you are taking steps for living a longer, healthier life.
Joining us is Atif Fareed, Director of the American Muslim Community Clinic. Welcome, Atif. Thank you for joining us today.
It's my pleasure. It's my honor to join you.
Thank you. I wanted to talk about the services that the American Muslim Clinic provides, Atif, and I know that you're a relatively new service in our community, so can you tell us a little bit about what you guys provide?
We have a medical clinic that we started January 13th of 2017, and summer this year we started a mobile clinic, and in July 13th of this year we started a dental clinic also.
Wonderful. Wonderful. So Atif, how do people make appointments or receive your services? How do they go about doing that?
The medical portion is very easy. You go on our website, you make your own appointment.
Okay.
We take people by appointments only. On rare occasions, we do have walk-ins, and we try our best to accommodate walk-ins. So we have never turned away a walk-in person, but we encourage everyone to make an appointment. And now we have expanded hours and expanded services, so it's easy to get an appointment within the week.
So what type of care would somebody receive when they make an appointment? Are they able to see a specialist? Do they see a general practitioner?
Usually we'll have a general practitioner at our clinic itself. And so chronic disease like diabetes, hypertension, things like that, we take care of that. And if we need like an OBGYN or a pulmonary specialist, we have a list of volunteers, and we can recommend that they go there, and then they can follow up over there.
Okay, excellent. Atif, I know when we visited your facility, you were also sharing with us that you also have assistance for laboratory work and for medication. Can you tell the viewers about that some more?
We have Medical Arts. It's a private, I think they have 6 facilities here in Central Florida. So they give it to us at cost. We're trying to get free services. We have asked Florida Hospital and South Seminole Hospital for free services, yet we have not been able to get that, but I think eventually we will. So Medical Arts will give us basically at their cost $10, $12. And in some cases, based on the physician's recommendation to the clinic, we give a 50% discount coupon, and the Medical Arts will bill us for that 50% that the patient cannot pay. Then we have teamed up with Longwood Pharmacy that provides almost 40 medications absolutely free, and there are some that they charge $3 or $5. And in some cases, when the patient cannot afford that, we will pay that prescription also.
That's wonderful, Atif. I know you mentioned mobile services. Can you talk a little bit more about the mobile unit and where you go and what type of services you're able to provide out in the community?
We are very excited about the mobile services. We're still learning as we go along. So we come to the homeless shelter here in Orlando and in Sanford. We've gone to like the refugee centers. We've gone to Fort Mellon when there was a race going on. So whenever people invite us, we go. We're going to go to Lake Eola on Christmas Day, and there's a big event there. So whenever there's a big event, people invite us, and we usually send either a AR&P or a physician assistant, couple of nurses, couple of staff, and we mostly provide general practice services there. If they need more, then we invite them to the clinic to come.
Excellent.
So we have done on average 2 or 3 every month. I would like to bring the numbers up,
Sure,
but
sure.
I need more volunteer physicians to help me make that possible.
Absolutely. Atif, after somebody visits your facility, if they're trying to locate a primary care doctor or a medical home, what type of referral services do you have in place?
For the physician services, we have a list of physicians that we can provide to our patients, but a lot of the time they come for follow-up to us. Sure. So unless they need a specialist, we invite them to come back. Okay. So we have patients who we set their appointment up 3 months into the future, so they can come up for a follow-up, and if they need to come sooner, we can always accommodate them.
What a valuable service to our community. What message would you like to leave our viewers about the clinic and the importance of providing this service?
So they come to us in big numbers. So there is an underlying population that has not been giving medical services. So we are very pleased that we can do our part because I think healthcare is a human right. So we want to provide that, and we want to give them an excellent service. From giving them an appointment, we offer them bottled water. We take very good care of our patients, so they feel loved, honored, and respected when they come to our facility.
That's amazing.
So you can reach us on our website. You can even call us. We are on Facebook. We are on Instagram. We are on Twitter. So you can easily reach us. And we are always looking for more healthcare professionals to volunteer with us. You can go on our website and sign up.
Okay.
I have about 5 physicians and 11 dentists. I would like the physician numbers to go up a little bit more,
sure,
so I can provide more services.
Atif, thank you so much for sharing your services with us today.
It's my pleasure.
And thank you for the valuable service that you provide to our community. You have raised our awareness about the needs, and we really appreciate you being part of this community.
Well, we are honored to be part of the community. The Department of Health here in Florida has been really good to us, has been very supportive of us, and so they've given us a lot of guidelines, and anytime we have a question, we can always reach out to them, and we have partnered with other nonprofits in the Central Florida area, and so we share resources, share some ideas. Sure. So it's been a good work in progress, and I'm so pleased that there is an opportunity for those who are sick to get medical care instead of waiting hours at an emergency room. So instead of going to the emergency room, we would like them to come with us, because we can give you a guaranteed time to see a doctor, and 99% of the time we don't run late because we have enough staff and we don't overbook. So when you come to our facility, you hardly ever wait. With 5-10 minutes you will see a doctor.
That's great.
So we're trying to provide great service. That's the goal.
That's excellent. Thank you so much for joining us today.
My pleasure. My pleasure. Thank you so much.
Dental sealants are offered to children at local schools here in Seminole County. Here to tell us more is Myrna Chamorro.
Joining me is Miss Debbie. She's a dental hygienist for the Florida Department of Health in Seminole County, and we're here at a local school. Hi, Debbie. How are you?
Hi, great.
Tell us a little bit about the school-based dental sealant program.
Well, the dental-based sealant program is a program where we go into the schools and provide dental sealants for school-age children. Dental decay is the single most common disease among children. It's actually 5 times more prevalent than asthma. So we want to reach as many school-age children as we can to apply these dental sealants to prevent cavities from forming on their teeth.
So this is wonderful. It's a great service to provide. What schools do you go to, and what students can qualify?
Well, in Seminole County, we actually have an agreement with the school board that when we started out actually with 16 Title I schools, And now, unfortunately, because some have lost their Title I eligibility, we're down to 12, but we are working on incorporating fifth graders. Right now, we currently see second graders.
So how do you incorporate the parents? How, are they comfortable with this process? How do they give consent?
Yes, we send home forms and information packets so it explains what a dental sealant is. This is right now, like I said, we're only seeing second graders. So when they return a consent form, all they need to do is fill out the child's information with their permission. By signing it, we will see any child with a return form.
So how many children do you see per day?
Well, it depends on the school schedule. It can vary anywhere. I'd say minimum would be 9 children up to 18 children per day.
Some children might be uncomfortable, nervous. Maybe their parents have told them ahead of time, maybe not. So what is the process once you receive a student?
Well, when they come in, of course, yes, they're all nervous because they don't know what to expect. And as I explain everything, I show them everything, each process and each procedure that I do, I tell them what I'm going to do beforehand. I let them experience even feeling like the air or water on their hand before applying it in their mouth so they feel more comfortable with everything.
Any final message for our viewers, for the parents that are looking?
Just take advantage of this great program. Whether a person has insurance or not, I will see everyone and do as much as I can for all students.
Thank you so much, Ms. Debbie.
Thank you.
To tell us about the Nemours Autism Program is Martha Santoni. Welcome, Martha. Thank you for joining us today.
Thank you for having me.
So, Martha, I know that the health department has partnered with Nemours over the years to provide screenings for autism. Can you tell us more about the autism screening program at Nemours?
Sure, yes. Our team of multidisciplinary specialists, they go out into the community and provide screenings for families that have a concern regarding their child's development and reaching milestones. So during the screening, they'll be asked questions on how the child interacts with other children their age, how they interact with their parents, and then from there they will recommend for the further steps to help the child.
Okay. Martha, I know that the screening is obviously part of the program, right? But what other services or referrals does the family receive that day when they come in for screenings?
So that day, it depends on the county we're in. For instance, at Seminole, you provide us with a room at the Seminole Department of Health, so we provide vendors within that county that might provide additional services for the family, such as UCF Card, Autism Speaks, Healthy Start Seminole. Additionally, we do have our Florida Prevention Initiative program at Nemours that comes in, and while the family is waiting to be screened, we conduct free vision screenings as well.
That's excellent. Martha, how long after the screening does the parent or do the parents receive results or counseling?
Well, that day they'll receive next steps. So whether it's maybe a recommendation for a speech therapist, and they could go wherever is convenient for the family, or they will receive a recommendation for a further evaluation to see if the child might fall within the spectrum of autism. It's best to get the child services early so the child does not fall behind.
And would they go to Nemours for those follow-up visits, or where would they go?
We provide them with information with other community providers, because the important part is to get the child in where it's easily accessible to the family. So that might be somewhere closer to where they live.
I see.
So whatever works for the family, that's where we would recommend.
Excellent. So I know the mobile unit visits other counties besides Seminole, and if you can tell us a little bit about when the mobile services started for autism screening and where you visit throughout the year.
Yes, sure. It started probably about 6 years ago, so we've been doing it for a while, and what we're finding is a lot of families had questions, and we do recommend, if the family has any concern or question, to go directly to your pediatrician and make sure that the pediatrician can give you a direction on the next steps or any recommendations. But a lot of families have challenges with transportation and access. So we like to go all over the Central Florida counties with Seminole, Osceola, Brevard, and in Orange County, because we're in a little bit to the southeast part of the county, so we like to go more toward the downtown or West Orange or East Orange as well, to make sure we're providing services for the whole population of Central Florida.
That's great, Martha. What activities do you do with the schools? Do you work with school systems as well? I know sometimes they're present, you know, when you provide the screenings with bring the mobile unit to Seminole, but what interaction do you have with the schools in helping the parents navigate services through the school systems?
So we definitely invite early steps because, you know, they also provide certain screenings and certain services to families, especially in that 0 to 3, 0 to 5 range. And with the schools, we help provide like the 504 plan and the IEP plan. So when the child does go to school, they have certain accommodations that will best fit with the child's needs.
That's perfect, Martha. Is there a cost associated with the screenings?
With the screenings, no, there will be no cost, but there will also not be a diagnosis because it'll be just a screening, and then the parents will be given a guide to their next steps or next recommendations.
Okay. And then, Martha, where would parents go to find out more information and resources about autism spectrum disorder?
So there's several resources. We have a free website. It's called kidshealth.org. And there's resources there for autism, but any other developmental or anything the parents might have concern about between 0 to teens.
Martha, what message would you like to leave our audience about autism and the resources available?
Well, I've mentioned before, the earlier is the better to get resources to the child. That might be, you know, speech therapy, occupational therapy, applied behavioral analysis therapy. So if a parent has any concern or if a teacher comes to you with a concern, let's not keep that to ourselves. Make sure we tell the pediatrician, because they're supposed to be the pediatric experts, and voice our concerns and be an advocate for your child.
Absolutely. Martha, thank you so much for joining us today and for sharing this valuable information.
Well, thank you for having me. And thank you for hosting us again in March. We appreciate it. Thank you so much.
Our pleasure. Thank you. Mobile health services in Seminole County are delivered in the community through mobile units or outreach in local neighborhoods. For more information about the community integrated mobile health services at the health department, contact 407-665-3026. Thank you for joining us today, and thank you to our distinguished guests. I'm Donna Walsh for Healthy Seminole. See you next time.